This is a crash course on the pediatric crash cart. Just like the adult crash cart, the pediatric crash cart is going to have a tag on it that you need to remove to be able to open the door and get into the drawer. In the emergency department, on top of our crash cart should be the things that we need for the defibrillator. For example, the pads, pediatric and infant pads that would go on top, and any cords that are going to connect to our monitor. You'll notice that there are 10 drawers. The top 3 are tan, and then the bottom are color-coded. This is important based off of our Broslow tape for our pediatric patients. We're going to go through each drawer so that I can show you exactly what's in the crash cart. The top drawer is basic supplies that you may need when resuscitating a pediatric patient. This includes things like infant and pediatric electrodes, CO2 detectors, laryngoscope handles, LMAs, Yonkauer suction handles, suction catheters, bulb syringes, IV arm boards, IV start kits, your IO infusion needle, your primary IV tubing, secondary IV tubing, extension sets, stopcocks, including a 3-way stopcock, 10 ml syringes, chloropreps, alcohol pads, iodine swabs, tongue blades, biohazard bags. There's urinary leg bags, and then an infant urine collector pouch, as well as your Broslow tape. Top drawer, basic supplies. Okay, your second drawer is going to be IV push medications. Okay, very similar to the adult crash cart. This includes medications like epinephrine and atropine over here on the side, and lidocaine is back here towards the back. We also have calcium chloride, sodium bicarb. There's an infant and pediatric different dosing, so we need to pay special attention to that. This one, the infant dose happens to be in a vial. Sometimes it is in an abject. Then we also have naloxone, amiodarone, adenosine, calcium gluconate, and romazicon, and dextrose. Okay, those are our IV push medications. That was the second drawer. And the third drawer is going to be our IV fluids. Okay, this includes things like dobutamine, dopamine, D5.5 normal saline with potassium, magnesium sulfate. There are also several different volumes of normal saline in this drawer. Again, the third drawer is our IV fluids. There are also labels in this drawer, so if we're mixing anything, then we will be able to label that. Then we're getting into the color-coded drawers, okay? This is important to note because in the pediatric patient, we are familiar with our Broslow tape. So if I have the patient, I've measured the patient, and they're in the pink and red area of the pink or red area in the Broslow tape, then I am going to get into the pink and red drawer to obtain supplies that I might need for that patient. Okay? In the color-coded drawers, it's a pouch of items, okay, and that might be needed based on the size of the patient. Okay, these kits include IV catheters, extension sets, blood pressure cuffs, oral airways, nasopharyngeal airways, our ET tubes, stylets, suction catheters with a tray, our Foley catheters, thoracic catheters, and our stomach tubes, G tubes. Okay, each drawer contains a pack of all of those supplies. Okay, and it contains different sizes based on the size of the patient. On the side of the crash cart, you're going to find ambu bags. So we have an infant ambu bag, a pediatric ambu bag, and then the adult ambu bag. You're also going to see a respiratory bag that has pediatric and infant cannulas, as well as nebulizer mask and tubing, and other equipment for positive pressure if we're using that in the pediatric patient. On the other side, you're usually going to you should find an extra oxygen canister, and then we have color-coded sheets that basically go over dosing for each child. Okay, so again, this would be for the pink, white, yellow. So this would kind of guide us in our medication dosing. It has an ml dose and a milligram, and comments about when we can repeat it, maximum dosing, and things like that that are going to help us in this pediatric code.